Madam President, I rise today to speak on behalf of the 1 in 3 Ohioans who know somebody who is struggling with addiction to heroin or prescription drugs. I rise today on behalf of the over 5,000 Americans who have lost their lives to a heroin or prescription drug overdose since the Senate passed the Comprehensive Addiction and Recovery Act back on March 10th. I rise today to talk about an epidemic that's affecting my home state of Ohio, that's affecting your state, whatever it is, that's affecting our country and must be dealt with. This is the fourth time I have come to the floor of the Senate since we passed CARA, which is the Comprehensive Addiction and Recovery Act, and I come to the floor to talk about our legislation and to ask the House of Representatives to please pass that legislation, which would then go to the President for his signature and could begin to help in communities all over this country. The legislation that I'm talking about is legislation that the senator from New Hampshire, who is the chair right now, the presiding officer, has been involved with in a very deep way in her home state of New Hampshire and also here on the Senate floor. I appreciate all the hard work she has put into this, and I know she agrees with me that it's time for the House to act. We passed it again on March 10th. That means it's been 47 days since the Senate acted. Now, about 120 Americans die every day of a drug overdose. It's been 47 days. That means we've lost about 5,600 Americans to drug overdoses since the Senate passed this bill. And by the way, it's not just about that tragic loss of life. It's about so many people who may not have overdosed but have this addiction and are not taking care of their families, or are not able to be at work and be productive citizens, or not achieving their God-given potential. It's about those who have overdosed but have been saved by this miracle drug that police and firefighters, other first responders, and sometimes family members now are administering, called Narcan or naloxone. But it means that since the Senate passed this bill, this epidemic is getting worse, not better. And that's based on all the information that I see back home. Last week in Lebanon, Ohio, it's a small town north of Cincinnati, Ohio, where my family has roots going back to the 1920s. In Lebanon, Ohio, a 34-year-old woman who was engaged to be married overdosed and died in front of her children, one age 10 and one baby girl who was still learning to walk. By the way, that little girl's father has now been arrested. Within days of her mother's addiction, she's now lost both her mom and that baby's father. Last week, from Tuesday afternoon to Wednesday morning, 6 people died of overdoses in one small town called Elyria, Ohio. It's not a big city, Madam President. They've got about 53,000 people in Elyria. We lost 6 people in 24 hours. That doesn't include the 14 people who were saved by this miracle drug I talked about, naloxone, that reverses the effects of an overdose. That's what's happening. It's happening on our streets. It's happening, in the case of my hometown of Cincinnati, in our parking lots at noontime on Sunday. In my hometown, a man overdosed in the parking lot of the Museum Center in Cincinnati, Ohio. First responders moved quickly, were able to save his life, but it's happening in broad daylight, unfortunately, more and more frequently. Since 2007, drug overdoses have killed more people in Ohio than car accidents, making it the #1 cause of accidental death. I'm told that nationally now, it is the leading cause of accidental death in the country. It's not car accidents, which we might have assumed, it's overdoses. They've more than tripled in Ohio from 1999 until 2010. We're told now that 200,000 Ohioans are addicted to opioids. 200,000 people. That's the size of a major city like Akron, Ohio. That's something that should concern us all. Last week, there was a poll that showed 3 in 10 Ohioans know someone who's abused prescription drugs. 1 in 8 know someone who's overdosed. That's more than 1.3 million Ohioans we're talking about. According to NIDA, the National Institute on Drug Abuse, the United States, even though we make up about 5% of the world's population, we consume 75% of the prescription drugs. including the vast majority of the world's prescription painkillers, the narcotic painkillers. They say 4 out of 5 of the people who are heroin addicts started on prescription drugs. And we've heard more about this week in the news, about the fact that so many people get addicted to the opioid, which is a prescription drug, sometimes actually prescribed to them, sometimes they obtain it illegally, turn to heroin as a less expensive alternative, and then end up overdosing, and the results are tragic. So if this isn't an epidemic, I don't know what is. And it's affecting every area. It knows no zip code. So when you think about drugs and drug abuse and the effects of it, you might think inner city. That's not so. It is everywhere, in the suburbs, in the rural areas. It knows no zip code. I mentioned this legislation that we worked on here for a few years passed the Senate. It was bicameral legislation, meaning it was the House and the Senate working together for 3 years. We had 5 conferences here in Washington. We brought in experts on the issues of prevention and education and treatment and recovery and how to deal with our veterans who are coming back, who have a high rate of addiction, how to deal with women and their babies. You know, in my home state of Ohio, we've had this huge increase in the rate of babies being born addicted, and what do you do about that? We put together this legislation in a comprehensive manner to handle not just one part or one sector, but to be something that would deal with the holistic approach so that we could actually get at this issue. In the House, by the way, the identical legislation was introduced, and they now have over 120 co-sponsors of that legislation in the House. And yet they have not been able to move on that legislation. Instead, they're moving on other legislation to deal with the issue, and that's good. I'm sure there's a lot of other things that can and should be done, and some of what they're doing is consistent with CARA. But we know CARA works. We know if we could pass it, the president would sign it. We know that it could help immediately in our community. So again, I call on the House to move quickly. Last week, a subcommittee in the House chaired by Joe Pitts marked up a dozen bills that have to do with how we fight this epidemic. Joe Pitts is a man who cares a lot about this issue. He's got a passion for it. This week, my friend and full committee chairman Fred Upton is going to mark up those 12 bills. The House has a lot of good ideas, and that's fine. That's good. I joined Congressman Bill Johnson of Marietta, Ohio, who's been a passionate advocate on this issue, to introduce something called the Preventing Abuse of Cough Medicine Act, which would restrict the sale of certain cough medicines that are frequently abused. That's good. It's a common sense Ohio idea, and I thank my friend and colleague for doing his part to help our constituents, and that should be passed in addition to CARA along with other legislation. And I certainly respect my colleagues over there very much, as I said. But let's just give CARA a vote, and then let's move on this other legislation as well. It takes a while, as all of us are painfully aware, to get something through the process around here. This one went through with a 94-1 vote. It's comprehensive. It was introduced in both the House and the Senate. They have over 120 co-sponsors. Let's just move that, and then if there are other things to be dealt with, like the one I talked about, we can work on those as well and find ways to work together to find common ground. I will support that. I can't speak for all of my colleagues, but I can speak for all of them, with the exception of one who voted the other way, to say we will help get CARA to the president. In fact, it doesn't need to come back to the Senate if they pass the CARA legislation. More and more members in the House are focused on this issue, and that's good. Tomorrow, the House Judiciary Committee is also marking up legislation in this area. So this is a separate committee, Energy and Commerce Committee, and now this is the Judiciary Committee. They're going to mark up 5 related bills, including what they consider the alternative to CARA. It has some of the CARA provisions, but not all of them. Let me tell you what the experts are saying out there. There are over 120 groups who have endorsed our legislation, helped us to get our legislation through. Yesterday, Daniel Raymond, the policy director of the Harm Reduction Coalition, sent a letter to the Judiciary Committee saying that its alternative, quote, omits vital provisions in CARA addressing recovery, collateral consequences, prevention, and education. These omitted provisions represent critical community priorities which truly relate to the comprehensiveness of CARA's approach. CARA was developed through a process of extensive consultation with dozens of stakeholders and has secured the broad support of national, state, and local addiction and recovery, public health, and criminal justice organizations. The version of CARA passed by the Senate represents a substantial consensus among both community stakeholders and bipartisan lawmakers, end quote. House Judiciary's alternative to CARA, again, does contain some of CARA's best proposals, and I appreciate that. But unfortunately, it drops out a number of really important ones as well. Some of the most important ideas that are missing include provisions expanding drug take-back programs. Again, we talked about this earlier. These prescription drugs are at the heart of this problem. And these take-back programs gets these prescription drugs off the bathroom shelf, allows us to pull these drugs away from our communities so that people are not using these drugs to get into more drugs to get into heroin. That's not in there. There's also a heroin law enforcement task force that was dropped out, a drug court for veterans called the Veterans Court. That's a very important issue for all of us. The veterans' testimony that we got made it clear to us that these courts are working. I've toured some of these courts. I've had a chance to sit down at a roundtable discussion in Ohio with one of our great veterans courts and talk to veterans whose lives have been entirely turned around by these veterans courts after years and years of bouncing around in the prison system or at the VA. Finally, they get into these drug courts for veterans where they're surrounded by other veterans and they're able to pull their lives together, get their families back together, and in one case, go back to school, one guy about to graduate from The Ohio State University after years and years of not being able to find a way for him to move forward. Here's another one. Patty McCarthy Metcalf of Faces and Voices of Recovery wrote in a letter today that taking out the CARA recovery provisions, quote, will prolong the crisis of addiction by not providing the critical support in communities across our nation where it's most needed. Recovery services provided by recovery community organizations, including recovery coaching in emergency rooms and drug courts, and recovery education and awareness are desperately needed and highly effective in getting people with addiction on a long-term path to recovery, end quote. What does she mean by all that? She means that these recovery coaches and the services that are supported by the CARA bill help to get people who might go, as she said, to an emergency room because they have an overdose to be confronted by somebody who says, look, we can get you better. You don't have to do this again. You don't have to overdose again. You don't have to go through this near-death experience. We can get you into a program where you can get treatment and recovery. Someone has to provide the resources for those coaches. We want those coaches. All of us as citizens should want them. We don't want people to keep overdosing again and again and again. We want to break that cycle. That's what our legislation would do. Patty makes the critical point that our response has to be comprehensive, and I think she's right. She says, and I quote, prevention, treatment, and enforcement cannot solve the opiate problem without recovery supports. National experts on addiction and millions in recovery agree that a comprehensive approach is critical. That's what we do. CARA is comprehensive. There are 71 recovery groups, including the Ohio State University Collegiate Recovery Community, that sent a letter to the House Judiciary and the Education and Workforce Committee today expressing concern that 2 sections of CARA were dropped out which expand recovery supports for students in high school and in college. These are amazing programs. I am so impressed with these brave young men and women who stand up and say, I've got a problem. I have an addiction. For other students at this high school or at this college who, like me, have this addiction, have this disease, I want to help you. We should work together and come together as support groups. There didn't used to be any of these hardly, as far as I know. Now there are a number, and Ohio State University is one of the places that took the lead in this, and I'm so proud of those students who stood up and said, despite the stigma around this, I'm going to stand up and say, I have this problem, and I know many of you do too, and if you do, come and we can work together to work through this problem. Again, what they say is, quote, we support a comprehensive approach to addressing this epidemic, which must include providing recovery supports that enable individuals to enter and sustain their recovery, end quote. Again, CARA is comprehensive. No other bill comes close. As this process moves forward, I hope we will insist that any final agreement represent a comprehensive approach, because this epidemic has to be combated from all angles. The approach we took to writing CARA was to say, we're going to take the best ideas, regardless of where they come from. We don't care who brings them. We just care what the idea means to help address this problem. We had ideas from Democrats. We had ideas from Republicans. We had ideas from House members, from senators. from experts, from law enforcement, from patients in recovery. We didn't ask who had the idea. We asked if it was a good idea. Now, that's how you cobble together good legislation that makes a difference in our communities. On Friday, I was in Ohio chairing a hearing of the Homeland Security Governmental Affairs Committee. It was at University Hospital in Cleveland, Ohio, and we heard from law enforcement experts, like Attorney General Mike DeWine, Acting U.S. Attorney Carol Rendon. She was great, as was Senator DeWine. By the way, law enforcement, including the Fraternal Order of Police, has been strongly supporting of CARA because they believe this comprehensive approach works. We also provide training for the administering of this naloxone. We talked about the Narcan and being sure that law enforcement has what they need to be able to help combat this issue. We also create these law enforcement task forces to combat heroin and methamphetamines. They want better tools, law enforcement does, so they can save lives, and we owe them that. In Ohio, I'm told, by the way, that our first responders have used naloxone more than 16,000 times in the last year alone. 16,000 times. Thank God for those first responders, because they have saved thousands and thousands of lives. On Friday, we also heard from Tracy Plauck. She's from the Ohio Department of Mental Health. We heard from Dr. Nancy Young of the Children and Family Futures, from Dr. Margaret Kotz, who is the Director of Addiction and Recovery Services at the University Hospital in Cleveland. She's one of the experts we've relied on. They talked about the recovery process. Their point was that probably 9 out of 10 people who need treatment are not getting it. It's a clear sign the status quo is not working. Some of it's the stigma we talked about earlier, people not coming forward. Some of it is not having treatment programs that are accessible. We heard about waiting lists. Sometimes 3 or 4 days, sometimes 14 days, sometimes a couple months. And people being at that point in their lives where they're willing to come forward and say, I need to solve this problem, and yet there's a waiting list. So last night I had a teletown hall meeting. We had 25,000 Ohioans on at any one time. It was a big group. It was people talking about all kinds of issues, from the terrorist threat we face to energy and environment issues to the jobs issues. And one guy called in and he said, what are you doing about treatment for people who have drug problems? And so I told him about the CARA legislation, and he seemed to have a quiver in his voice. And so I asked him, I said, you seem to have a lot of interest in this and some information about it. Can you tell us your background? I thought maybe he was a doctor or a treatment specialist. And he said what you hear from, unfortunately, more and more parents, which is, I lost my child to addiction. She had an overdose, she died. And the reason I'm so focused on treatment, Senator Portman, is because we got her to the place in her life where she was willing to go finally to a treatment center and get the treatment and recovery services she needed to deal with this disease that had gripped her. And there was no room at the inn. There was a waiting list. We couldn't get her in. And it was during that period when we couldn't get her into the treatment center that would have helped her that she overdosed. This is a caller last night on a call who was willing to say this in front of 25,000 people, and I told him I appreciated the fact that he had the courage to call in and the courage to talk about it, and of course expressed my sympathy to him and his family, but asked him to continue to talking about it, to channel that grief into something positive. I can just tell you, until we get more people into treatment, this is going to continue to be a huge problem in every one of our communities. Until we change the law, until we get legislation passed here in Washington so that we can be better partners, we're not going to be doing our part. Will Washington solve this problem? No. This problem is going to be solved in our communities. It's going to be solved in our families. It's going to be solved in our hearts. We've got to get people to pull away from this, to understand the dangers, better prevention and education. By the way, in our legislation, we have a prevention program to build awareness about the connection with prescription drugs and heroin. I will bet most people listening right now didn't know about that connection. A lot of people don't. Why would you if you hadn't faced this issue? That awareness alone is going to make people make better decisions for themselves, for their children. We had a guy testify in Friday in Cleveland whose son died of an overdose. You know why? Because he had his molars, his wisdom teeth taken out. And when he had his wisdom teeth taken out, what happened? You know where I'm going. They gave his son, a kid, Percocet, a narcotic painkiller. And the rest of the story you know, which is he started taking more of those, and then he took them from a bathroom shelf of one of his relatives. He developed this addiction and eventually turned to heroin and overdosed. And now his father, God bless him, is out there talking to high schoolers, talking to middle schoolers, talking to young people about the dangers. We can address this issue. We know we can. There have been success with other awareness programs. Think of smoking and teen smoking. We've made great progress there. We have to make progress on this one. This is about life and death. We heard testimony on Friday from Dr. Michelle Walsh. She's the director of neonatology at University Hospital. She talked about how she's increasingly seeing babies who are born with what's called neonatal abstinence syndrome. That's a fancy way of saying that these poor babies are born with an addiction. And she said the symptoms are the same you'd see with an adult. It's the fidgeting, it's the sweats, these are little babies. And I've gone to these neonatal units, and some of my colleagues have, I know. And you see these babies, and they're so small they can fit in the palm of your hand. And here they are, addicted. And you have these doctors and nurses, incredible compassion like her, Dr. Michelle Walsh, who are taking care of them. We've had a 750% increase in the last 12 years in babies born with neonatal abstinence syndrome in my home state of Ohio, a 750% increase. Every single neonatal unit in Ohio is facing this. I've been to Rainbow Children's in Cleveland, which is at this hospital. I've seen what they do. I've been to St. Rita's in Lima, Ohio. I've been to Children's Hospital in my own hometown. They're doing great work. But wouldn't it be great if we didn't have to deal with this issue because we had better prevention and education to let mothers know what the danger is when they are pregnant, and had better treatment and recovery to get those women out of this grip of addiction so that their babies could be born without these issues. The long-term effects we talked about at our hearing, frankly, talking to experts and doctors, I don't think people know what the long-term effects are. And that's scary, of course. They basically take these babies through withdrawal. Have to provide babies with the medication at a lower level, but that you would provide an adult to take them through a withdrawal process. CARA, our legislation we were talking about, would help these women. It would help these babies by expanding treatment for expectant postpartum women, as well as awarding grants to evidence-based treatment services and residential treatment programs for pregnant women who are struggling with addiction. It would create a pilot program to provide family-based services to women who are addicted to opioids in a non-residential outpatient setting. So it's stuff that we learned from experts. How do you help address this problem that's in the legislation? Again, I know there are other ideas out there, and that's great. But stripping out some of CARA's core provisions just doesn't make any sense to me. Let's keep it comprehensive. And let's be sure and get this legislation done and then work on additional legislation. The House could simply put CARA on the suspension calendar and have a vote on it. That's the calendar where you have to have a 2/3 vote, but something like this with all the co-sponsors and all the interest in this issue now, I think it would pass. That means we're one vote away of getting this to our communities to help. That's how close we are to an historic achievement to help begin to turn the tide, to make the federal government a better partner with our states, our local communities. Our great nonprofits are out there in the trenches doing the work, our families, and there's no reason it couldn't happen today or tomorrow or the next day before we go into another congressional recess. Again, after 3 years of work, it doesn't make sense to start from scratch and try to rewrite this. Let's work together to come up with additional ideas. That's, of course, appropriate. Nobody has a monopoly on good ideas around here. And believe me, I know some of these House members, they have the right intentions. They're trying to help. I appreciate that. But I also think that we all need to appreciate the fact that this is a crisis. We are losing more and more Americans, 5,600 since CARA was passed in the Senate. Roughly every 12 minutes, we lose someone else. People's lives on the line. Communities are being impacted. Families are being torn apart. It's time for us to act, and act quickly. Madam President, I appreciate your giving me the time today. I yield back that time, urging the House to move quickly on this legislation so we can begin to help our communities in need.